Okay, let's do a thoracic spine now. Going to register my patient. They're in there changing. I've already screened them. They're ready to go. They're cleared for their thoracic exam. I need my thoracic spine assist. This is just, once again, this is just so we can get those stock images to work off of. So I'm uploading that thoracic spine assist. This is not the protocol that I'm running yet. And I'm just going to make all of this go. This gives you, when it's doing your scout images, it is going to give you this automatic table movement. This pops up so you can let your patient know that their table's about to move. Because Siemens, that it's scouting the entire spine, so it's going to scout the cervical, it's going to move the patient in farther on the table, scout the thoracic, move them in another time, and then scout the lumbar, and then it's going to compose the entire spine. You may have to open these up individually and make them run if they don't go automatically. Okay, so I have my stock images. I did that thoracic spine assist, so I'm going to go put my patient in on the table. I've set my patient up on the table, so I'm going to come back to this console. Now I'm going to pull over my Owens protocol for the thoracic spine. Right now I'm pulling over the without, and I'm pulling over the whole protocol. Now it's running my 3-plane localizer. Now, if you were at a site that did not have the software and did not run a complete total spine, then you would be doing a large field of view for counting purposes to see the cervical and thoracic. You'd be doing another localizer, cervical thoracic for counting. But we have a composed scout that's in here. And we can actually pull that over, and we can drop that right there. So if you look at your sheet, the first thing it wants you to do is it wants you to do that T2 coronal localizer, which is also what pops up right there. We're looking to see if there's any curvature in your patient's spine. Is there any curvature, any scoliosis that's going on? So a lot of times that's what you'll run a coronal localizer for when you're doing spine imaging. So it scouted your patient's cervical, and then the table moved them in. It did a scout of their thoracic, and you can see as you hover over these scouts, this one just has the one line in front of it. That's the first scout, cervical. You come down here to thoracic. Oops, right there. See how there's two lines? So that's your thoracic spine scout. And then you come down to your lumbar, and now you can see that there's three lines in front of it. That is your third scout, that is your lumbar scout, and then it composes them all together. So we are doing thoracic, so I want my thoracic scouts pulled over. Okay. And I'm going to let you do a good coronal image so that you're able to see the spinal cord. Taking my slice lines off. So when you're doing this coronal localizer, we're going to count the vertebrae, and this is a nice that we get this composed scout, so now radiologists can count all the vertebrae. They can see if there's an extra one or not. But we just want to make sure that in these slices right here, we're catching the spinal cord. We want to catch the spinal cord, and we want to get all of the thoracic vertebrae in there. So I know this is L5, 4, 3, 2, 1, so there's my T12 vertebrae. Here I have that densodontoid process. This is my C2, 3, 4, 5, 6, 7, and there's my T1. It's cutting it a little tight on the cord, so I might just want to add 2 slices to that. So that way when I get my coronal, I'm able to see the spinal cord as well. So here's my L5, 4, 3, 2, 1, there's T12. And there's C2, 3, 4, 5, 6, 7, and T1. I'm just gonna pull this anterior rest slab in a little bit, making sure I'm not on my T12. 4, 5, 3, 2, 1. Okay. This just helps with all of that anterior motion that's coming from your chest and your heart. That's all I'm asking you to do. Okay, you just need to make sure that all of your thoracic vertebrae are covered and that you have the spinal cord in there as well. You're not adjusting parameters like TR, TE, or anything like that. And you're just going to hit go. Now if you look at your sheet, the first thing it's asking you on your sheet, after the T2 coronal localizer, it wants you to set up a T2 sagittal, and that's what pops up next also as well, right here in your Owens protocol. Okay, so I'm going to pull this field of view box over my thoracic spine, and I can tell this is not nearly big enough. I'm not going to catch all of those vertebrae, so I'm going to need to increase my field of view. Okay. So I've got L5, 4, 3, 2, I'm going through my L1. Here's my C2, 3, 4, 5, and 6. I'm going to probably go down a little bit. L5, 4, 3, 2, 1. So that's my L1, so I know the bottom of my field of view is going through L1. Here's my C2, 3, 4, 5, 6, 7, and I'm clipping the top of that C7, okay? So now I know I have all of T1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, and there's my T12. So I have all my thoracic vertebrae in there, and I'm centered over that spine. I can just go ahead right now and bring this anterior rest slab in a little bit. Okay, there's my T1, there's my T12. So I'm not on top of those vertebrae, so that's good. My phase is going head to foot. There's only 10% phase oversampling on, so I'm definitely gonna wrap. So I wanna make that 100%. Now I'm gonna scroll through this good coronal localizer that I had. I'm gonna have to angle slightly, it looks like, and I wanna center in the middle of that cord. Okay. So I can see spinal cord right up here and I'm through the middle of it, and I can see spinal cord right here and I'm through the middle of it. So I'm going parallel with that cord. Right there's my cord. Okay, can see transverse processes. Here's my vertebral bodies. This light area, that is your intervertebral disc space. So now I have my field of view, my phase oversampling's on, I have my angle. It says I want a slice thickness of 3 with a 1 gap. Okay, so 3 thickness at a 1 gap. Looks like I'm still covered. I have 15 slices. I'm still covering all of my vertebral bodies. Okay. If you thought that was a little close down here, you could add 17 slices. If your facility wanted those transverse processes, you may need to add a little bit more. But I like that, that looks good. And my T2 weighted, got a nice long TR, it's 4,000. I have a long TE, so that all looks good. Turbo factor 17, per your book, that should be okay. If you wanted to go up a little bit, you could. Okay. So that is the setup for my T2 sagittal. So I like it. My coverage is from C7 through L1, so I have all of that. You need to be in C7 through L1, count all those vertebral bodies. I'm gonna go ahead and hit go. Now, if I'm looking at my protocol sheet in front of me, so I just ran the T2 sagittal. So the next one on here is a T1. I'm kind of looking, nowhere on my sheet does it say I'm running a T1 sagittal, so I'm gonna go ahead and hit go. Now next on my sheet, it's telling me to do a stir sagittal. Well, I just did a great sagittal, so I can pull over a better one. I can use that as a reference. So you need to set this sagittal up identical to the T2 sagittal you just set up. So your fields of view need to match, your slice thickness and gap will need to match, phase, direction, coverage, angling, all of that needs to match. Okay, I'm just gonna go ahead and copy parameters just for time's sake, but you guys need to go back through all those steps and reset all of that up. Everything's identical except for your weighting parameters. This is a stir sequence. So stir is an inversion recovery pulse sequence. Okay, so we have to check our time of inversion. We're going to be suppressing fat. Stirs have a long TR. Typically those TEs, because we do want bright fluid, are usually in the 50s and 60s. I'm just going to go 55. I'm going to go under my contrast tab. Okay, under contrast tab is that magnetic preparation. You're going to find that slice select IR, that inversion recovery. This is where you're changing your TI, your time of inversion. Per your book, the time of inversion is anywhere between 100 and 175. Typically the values you're going to see in the clinic are gonna be between like 130, no higher than 170, but usually around 140, 150. I'm just gonna go ahead and go 150. Now, if for some reason you don't see it on yours, you're under the contrast tab and you're like, well, where is it? Where's my time of inversion? You have to click on this box, because right now they're saying none. You have to click on that drop down and go to Slice Select IR, and then it'll pop up your time of inversion to input it, okay? So I went through the steps. I made at the same field of view, slice thickness gap, all of that stuff. I looked at my weighting parameters. I like it. I have my coverage. All of my thoracic vertebrae are in here. This is my T1, T2, T3, 4, 5, 6, 7, 8, 9, 10, 11, and my T12. This is all skin back here. Okay, this dark band, this is your spinal cord, and it's surrounded by bright fluid, bright CSF, so that tells us that this is a T2 weighted image. It is not fat suppressed, because if it were, all of our skin back here would be dark. These are your individual intervertebral disc spaces. So if this is T12 and this is T11, this would be T11-12 intervertebral disc space right here. Okay, the middle part of it that's nice and bright, when it's healthy, it should be nice and thick and bright like this. This is your nucleus pulposus, and those outer edges are your annulus fibrosus. You have that posterior longitudinal ligament that runs along the posterior aspect of your vertebral bodies. And then you also have an anterior longitudinal ligament that runs along that anterior aspect of your vertebral bodies. Okay, this helps to stabilize the vertebral bodies. So if this is T1, T2, T3, this would be your spinous process of T3. Okay, these are your neural foramen openings, or your intervertebral foramen openings, where your nerve roots are coming through. Okay, these little black dots, those are your nerve roots. This is transverse process. Okay, so my sagittal's all set up. I like it. My weighting parameters are correct. I'm going to go ahead and hit go. The next thing on your sheet, it's telling you, so you're going to be doing a T1 axial upper stack, and you're going to do a T1 axial lower stack. So nowhere on this protocol is it asking you to do the T2 axial, so you're just going to go ahead and hit go and run it. So we want to do a T1 axial, and we want to do an upper and a lower stack. So I have this T1 axial open. I'm going to right click. I'm going to hit copy. I'm going to click underneath it. I'm going to right click and hit paste. So now I want to name one upper. And I'm going to name the other one lower. So we know these are all our thoracic vertebrae, and that starts with T1, because that's how we set up our field of view to begin with, setting up that sagittal. So if I'm looking at this, it's telling me to do a T1 axial upper stack to cover T1 vertebrae through T8 vertebrae. So here's my T1. I'm okay with this field of view. It ends back here. This is my phase over sampling. I'm not cutting out any spinous process at all. It's going A to P. I'm okay with that, but I probably need to open up that phase over sampling a little bit because I have a lot of anatomy out here. It's telling me I need to use a 4 slice thickness out of 1 gap. And now I know I'm gonna take a general angle through these disc spaces, and I'm gonna need to add slices to get through my T8 vertebrae. That's 12, 11, 10, 9, that's my 8. Okay, so here's all of my T1 vertebrae. I'm not cutting out the C7 T1 disc space. So I have T1, 2, 3, 4, 5, 6, 7, and I have almost completely all of 8. I'm going to bring this anterior rest slab in. This is going to help with a lot of that chest heart motion that's going on. Because my phase is coming in from A to P. It's supposed to be T1 weighted. My TR is too long, so I'm going to lower that. So now I have an appropriate TR and TE. Going A to P, I have phase over sampling on. If I want to make sure I'm nice and centered, okay? So I'm going to make sure I'm on my center slice on this thoracic. My sagittal box is highlighted. I'm going to highlight my slices. I'm going to right click and go shift to image plane. Centered over the cord here, and I'm nice and centered my axial. Okay, so that's my upper stack. I'm covered T1 through T8. I have a little bit of angle to go with these disc spaces. I've placed my rest slab or my pre-saturation band appropriately weighted. I'm going to go ahead and hit go. So now I need to do the same thing, except now I'm going to do the lower stack. Same field of view, going to open up that phase over sampling a little bit more. I need to be at a 4 slice thickness and 1 gap. So I'm at 4 and 1. Now I'm going to angle with the disc spaces down here. And now I need to add slices. So here's T12, 11, 10, 9, 8. you want them to overlap. So my upper stack, oops, my upper stack was down to this almost completely all the way through T8. You want the stacks to overlap because you would not want to risk cutting anything out, and typically then you could compose the two stacks together. Gonna make sure I'm appropriately weighted. My TRs, my TR went up as I added slices. It automatically adjusted my TR. So now I need to bring my TR back down. Okay. So I am T1 weighted. I'm gonna bring in this anterior rest slab or pre-saturation band. Okay, I know before in my upper I covered T1, 2, 3, 4, 5, 6, 7, and I was all the way down here in the bottom of 8. And so 9, 10, 11, 12. So I have all of them covered, and I'm angling with these disc spaces down here posteriorly. I'm centered. My coronal, my field of view box is nicely centered where you can see everything. And that's it for that without. So I'm going to go ahead and hit proceed. Okay. Now if you look at your with and without protocol, I'm just going to go ahead and run that. I'm going to open up under Owens user. Here's my T-spine for with and without. Okay, you're basically doing a lot of the same things. So the thoracic with and without, same thing. It wants you to set up the T2 coronal localizer, which we already did. It wants you to set up a T2 sagittal, which we did. And then instead of the stir sagittal, the with and without is asking you to set up a flare sagittal. Okay, so I'm going to pull that over. Now during your practical, you're going to just pull over your whole with and without and run through it. Just for time's sake, I'm just pulling over the ones that are different because everything else is exactly the same as to what we did. So I would have done the coronal localizer, the T2 sag. Now I'm setting up my flare sag. Well, I already did a T2 sag, so I know that my parameters are all going to be identical. They're going to match, okay? My field of view, slice thickness, gap. The only thing that's going to be different is my flare sagittal. I somehow have brain in here now. Okay. And if you don't remember what you used before, just do a quick open. Like, oh, okay, my field of view was 320, my phase percent was 109, I used 17 slices. I need to be at 4 slice thickness and 1 gap for this one. Which is different, okay? This is different, so make sure you pay attention to your paper because this is different than your one on your without. Oops. T2 Sag, same as, or T2 Flare Sag, same as my T2 Sag, and my T2 Sag for my with and without was a 4 thickness out of 1 gap. Okay. So make sure you're reading what it's telling you on your paper. I know I'm gonna need an anterior rest slab. So notice how it comes up in the axial transverse plane. I can make it go coronal, or I can just move it on my own. There we go. It says my phase direction's going A to P. I don't think I like that. I'm switching that to head to foot. Okay, so all my motion's going this way. And I'm definitely gonna need phase over sampling on. Now, there's so many different ways, once again, that you can do your rest slabs. We're doing an anterior rest slab, but you could theoretically do one that's superior to your field of view in your slice group. Okay, you could do one up there to help suppress flow coming down. You could put one inferior to help suppress flow that's coming upwards. Okay, so I have my L5, 4, 3, 2, there's my L1. There's my C2, 3, 4, 5, 6, and 7. So now I know I'm going to place that over my spine. I know that my field of view is in my L1, that's my T12, and that it's in my C7, so I have all of my T1. So 2, 3, 4, 5, 6, top of my C7. So that I have my field of view. I have my phase over sampling on. I'm bringing in this anterior rest slab. I added that on there. I'm going to look at my coronal reference image. I want to make sure that I'm in the middle of that spinal cord and I'm angled nice and parallel to it. Okay. Here's my cord, here's my cord. And I'm right down the center of that cord. Okay. With a 4 thickness and a 1 gap, I can probably take that down to 15 slices. 17's a lot. You could probably even get away with 13, depending on whether or not you want all of the transverse processes in there. But even with 13, I mean, according to your lab manual, you just have to cover all of your vertebral body from like right to left. And you are with 13 at a 4-1 gap. So 13 slices are okay, 15's okay too. Now we have to look at our weighting parameters. So we have coverage, we have angling, we've got our rest slab, phase direction, oversampling. We have a really long TR, TE. If you want to look at that turbo, you can. Nice long turbo factor. That all looks good. Now, it is a flare, so another inversion recovery pulse sequence, and we want to suppress our cerebral spinal fluid. So according to your manual, it says a time of inversion somewhere between 2,000 and 2,200. Okay, so I'm changing that. Another thing to kind of think about with our spine imaging too, so in your lab manual it talks about SAR a little bit. So we're dealing with really large fields of view, and we're dealing with rest slabs or pre-saturation slabs. So we're giving a lot of RF into our patient, and our patients can really start to heat up. in terms of our spine imaging. Underneath your sequence tab, if you go to RF Pulse sequence, click on that. There is a low SAR mode that you can click on. So just to kind of point that out, there is a low SAR mode that you can utilize. Okay, so we have that completely set up. We like our coverage, we like our weighting. Slices, everything should match up with our previous sagittal that we did. If we were worried about SAR, or we were getting pop-ups and our patient was starting to heat up, we could put that in low SAR mode. We could take off some of these turbo echoes, maybe lower that. You can always increase your TR, but we know, like lowering the turbo factor, increasing your TR, a lot of the things that you do to decrease your SAR are going to end up increasing your scan time. And I'm going to go ahead and hit go because I like it. The next thing it says to run your T2 axial to cover a MS lesion. Got some crazy pictures going on. All right. So we're just going to cover a MS lesion that is seen at the T7 level. So there's T1, 2, 3, 4, 5, 6, and here's my T7. I'm okay with this field of view. I'm going to center right back here. Field of view's okay. I'm going A to P. Might want to increase that phase over sampling. I'll want to bring this anterior saturation band close because my phase direction's going this way. This is my slice group. This will help saturate any of that out. It says I want to be at a 4 slice thickness and a 1 gap. Okay, so I'm at a 4 and a 1. I want to be T2 weighted. It looks like I am. My TR is 3500, TE of 106, so that all looks good. So I'm T2 weighted. I don't really need all of these slices. Now normally you would be able to see your pathology in there to see where the coverage is. We're just going to go off this, and it says MS lesion seen at the T7 level, so it says to cover T6 through T8. We can take some of these slices away. So that's 12, 11, 10, 9, 8. You can still take a couple away. So that's my T7. So I'll be about halfway through T6 and maybe halfway through T8. And we'll call that good coverage. So T12, T11, 10, T10, 9, 8, and there's 7, and then 6, 5, 4, 3, 2, 1. Thoracic really isn't, it's not as difficult as it seems, and once you start doing them, it won't be so bad. It's just counting, but once you get that first counting done in that first sagittal, then you know where T1 starts and T12 ends. Field of view box is nice and centered over it. I'm centered over the cord here. Sometimes when you're doing that spine imaging, if it's a curvy spine, you might have to put like a slight angle on the coronal reference images to kind of align a little bit with the disc spaces there. But our slices are going perpendicular to that spinal cord. I have my coverage, my rest slab, I'm T2 weighted. I don't think I left anything out, I like it. Okay, so now I can go ahead and hit go. You might also see the phase going right to left. Okay, due to some of that heart motion, maybe you'll see someone do it right to left. Just know you would really need to increase your phase over sampling to like 100%, because you have those arms, if their arms aren't above their head, okay, it's gonna come back and wrap. Alright, so we're gonna go ahead and hit go. Okay, so I'm gonna check this box. I went down here and I did the injector button here. I'm gonna click that patient has contrast agent, because the next thing on my protocol, my sheet, it says that you're gonna run a T1 sagittal post-contrast. Okay, so you don't run that until after you've injected contrast into your patient. So you need to record how much contrast you're giving your patient. I think my patient weighed, I think I put in 200 pounds, so I'm gonna go like 18 to 19 milliliters of contrast. So you need to put in the correct amount of contrast. You would talk to your patient, let them know they're about to get that contrast. And you're gonna set this sagittal up identical to the other sagittals that you set up. Just for time purposes, I'm gonna go ahead and copy. You guys are not allowed to copy and paste yet. But you're gonna go in, make sure all your parameters, you're gonna reset it up that your parameters are identical, field of view, slice thickness, gap, etc. And now you're just gonna look at your weighting parameters and make sure that it's T1 weighted. So I might wanna increase my TE a little bit. And that's it. So now we've done the thoracic spine, and then you would hit go. And so this is an axial of your thoracic, and we can see our rib attachments right here. Here's our vertebral body. This is your aorta. Here's the spinal cord surrounded by cerebral spinal fluid. Got a rib attachment on each side. Here's lamina. You can see some of the spinous process back there. It looks like they have a little bit of a disc herniation.